In 2004, we needed a new CEO. John Guest had retired and his successor had retired. So the board decided that they needed to do a national search for the best CEO we could find because we had grand ideas of what our future should be. Well, we did that. We got almost 100 applicants for the job, so it's a pretty good job to have. As we interviewed and talked to people, one thing began to come clear to me, and that is we have the best person suited for this position nationally in our organization, and he's the lawyer.
First of all, he had worked here at the county for a long time in the district attorney's office, and I think he saw a lot of the issues we have with health over here. That's our biggest responsibility, our biggest problem. And then when he went with the hospital district, I guess it was around 1990 or so, and was there for 14, 15 years or so before he became the CEO in 2004. So he had that great line of experience.
It was serendipity that I ended up working here. I went to law school in Washington, D.C. at George Washington, and I moved back and studied for the bar in the summer of '77. And during that time, I sprained my ankle. I had to come here. I was uninsured. In those 4 months, it's the only time in my entire life that I've been uninsured. So it's interesting that I'm working for a safety net, but it was a safety net that I needed when I graduated from law school, and they were there for me, and so I wanted to be there for them.
And one of the things that makes him special is the fact that he thinks of everyone that comes through our doors as being how he was when he came through the doors and didn't have any insurance.
George has a vision for University Health System, and he has a vision for the care of the patients in Bexar County and also South Texas, and anyone who needs care that comes to our hospital. And as CEO, George always looks at how we can be, and I think he usually says, good stewards of the taxpayer and of the funds that come into the organization. And he always makes sure that we're providing the highest quality care, the most compassionate care, and making sure that the leadership understands that the first thing we have to do all the time is make sure that the patients get the highest quality of care in facilities that we'll all be proud of.
Right after the big recession of 2008, we began to build, under George's leadership, a new university health system with spending almost $1 billion in capital.
Not only was it building the new Sky Tower out at the medical center, but also taking the Robert B. Greene hospital we have downtown and building a new 6-story building for it, 10-story building there. And the Commissioners Court had enough confidence in the leadership of George, the leadership of the Board of Managers, to vote for that without even going to a vote of the public.
When we were planning the buildings, we took trips to other places in the country. And without mentioning other hospitals, we went to a particular hospital that was very sterile. It didn't do anything to reduce your stress, and didn't do anything to convey the fact that the people who worked there were understanding or compassionate or kind about the care they were providing. And so we wanted to convey that through art. And we know that art has a healing effect, so that was another reason for doing it.
Most important besides all of that, though, was that George put together a top-notch team to provide the services that we needed to provide in that hospital.
He goes through this health system and he talks to people, and a lot of the staff know him as George. He's not Mr. Hernandez or, oh my gosh, the boss. He's George.
One of the qualities that makes George an excellent CEO is that he always listens to the leadership and tries to get all perspectives and points so that we're making the right decision, but everything has been considered.
George is superlative at being able to get people with differing views together and create what I call fellowship. Fellowship means the ability to work with other people with the idea being that together you're going to create something better than any single person could do.
I don't think we're the same organization that we used to be, and it isn't about buildings, it's about people. And people make a difference because they're the ones who take care of patients. And I get so many thank you notes from past patients and from family members, even when their outcome is not ideal, thanking them for their care, that's what I'm most proud of.
George Hernández is an excellent CEO, and that's not a superlative that's large enough to cover him.
Well, let me tell you, I don't think you'd have a better leader. He's responsive. Right now, we haven't even talked about that, but right now he has on the books building a new women and children's hospital, the first one in San Antonio.
George is driven by this passion to meet the patient's needs, the customer's healthcare needs, to improve the access to healthcare. And he's driven day and night by that, has always been as long as I've worked with him, which is 21 years.
I think that's what a vision of a CEO is all about. Making sure that you're planning ahead for the next group of leadership that's coming in, the next cohort of patients that are coming in, but being able to make sure that the legacy that you leave is one that you're going to leave the institution in a better place than where you started, but one that's also going to be committed to providing even higher quality of care.